we're going to show a chiropractic adjustment today. I'm Dr. Carl Rafey with Rafey Chiropractic, and this is Dr. Barry Reed. We have an office in Coleraine, Ohio, and Mason, Ohio. So I hope you find this interesting. What we're going to start with is we're going to start with the cervicals, and this is a seated cervical. And what we're doing is we're checking the rotation. We are seeing where the subluxations are, where the bones are kinked out of place, not allowing the nerves to work like they should. Now, this adjustment doesn't take very long because we've already spent time going through an exam and finding out what his problems are. It's kind of like when you go to the doctor and you spend a lot of time with the doctor getting a diagnosis, and then he gives you a pill. Swallowing the pill is the quick part. The adjustment's the same way. So we're going to find this and we're going to get this bone moving. Here's some clicks and some pops. There we go. That's moving better. We're going to check the other side a little lower. Relax your right shoulder. There we go. That sound you hear is popping, and that's the joints releasing nitrogen into the joints. So now the joint's expanded. It's actually hypermobile for the next 20 minutes. Go ahead and lay face down. This gives the opportunity for the person to exercise and stretch those ligaments and joints out to become more of a normal range. All right, so what we're going to do is we're going to check his feet. Now his leg is short on the right, and we're going to bend his legs up, and it gets longer on the right. Now what that tells me is that right sacroiliac joint, or the right hip joint, is not moving like it should. So what we're going to do is we're going to pump the sacrum. As we pump the legs, it makes the cerebrospinal fluid pump, because there's a pulse in the cerebrospinal fluid, and then just like there's a pulse in your blood vessels from your heart. There's a lot of tightness. You feel that there, sir? Yeah, a lot of tightness in there. So we're going to work on that in just a second. Right now, we're going to clear out the thoracic spine. As we move up here, we feel a lot of tension. Is that sore there?
Yes.
Yeah. So we're just going to, a little rotation, a little pressure to loosen that up. Good. Feel better?
Yep.
Awesome. So now what we're going to do is we're going to lay him on his right side, and we're going to release this joint. Lay on your right side there, sir. Excellent. Perfect. So we're going to tuck that leg in there. What this does, this tractions open this hip joint right here where your sacrum and your pelvis meet. Just really gently drop down. There we go. Excellent. Now lay on your other side for me. What we're going to do here is we're going to go up to L4, L5, which is the bottom vertebra. And we're going to use a little more pressure here. Rotate those things back around. And we're going to sit him up, and he's going to feel like $1,000,000.
Thank you, Doc.